Hello everyone, how you doing? It's been a long time. Your doctor is here again, Dr. Tinade. So today I'm going to talk about something very interesting, and we call that thing dyspareunia. See, medical jargons. Anyway, I'm talking about painful sexual intercourse. That's what we're talking about today. But before then, have you followed me on my page on Facebook, STI and Female Health Matters with Dr. Tinade, and I'm on YouTube. Please subscribe to my channel, Dr. Tinade, on sexually transmitted infections. I'm on TikTok. Just type my name, Ajani Tinade. I have another page on Facebook, and that is Dr. Tinade on adolescent and female health. And I have another one on TikTok, on Instagram. Just type my name, Ajani Tinade. So let's talk about painful sexual intercourse. So when we say painful sexual intercourse, what are we talking about? We are saying recurrent pain. So when we say recurrent pain, that's like the pain you have all the time. When you want to have sex, it can be pain before sex, during sex, after sex. So what we are saying that this dyspareunia is pain, recurrent pain before, during, and after sex. And it can be primary or it can be secondary. When we say primary, that means from the start of having sex, that person has always been having pain. And we have some other people that maybe initially, when they had sex, they didn't have pain, but later in life, they started having pain during sexual intercourse. Then, apart from that, we have different types. We have the one we call superficial, which means it's just at the point of entry. Then we have one we call deep. That means as the penis is going inside, deeper and deeper, they continue to have this pain. In fact, in some people, it can be as bad as when they are inserting tampons, they can have a pain. It's like, oh, they're having sexual intercourse and they'll be experiencing pain. So this painful sexual intercourse can occur in both male and females. So I'm going to take like 3 videos on dyspareunia. This is my first video. The second one will be on emotional factor or psychological factors that can cause painful sexual intercourse. And the third one will be on dyspareunia, painful sexual intercourse in men. So now talking about the causes, one of it is if there's no foreplay. Now I'm talking to married people, not singles. So if the foreplay, there's no foreplay, it's not enough, because ideally what foreplay is meant to do before penetration is to make the vagina to be wet, the glands will be secreted, the place will be wet. But if the foreplay is not there, is not enough, it can cause vaginal dryness, which can result in painful sexual intercourse. Then in menopausal women that have reached menopause, because the level of estrogen is one of the hormones in the body that help the vagina to be wet. When it's reduced, definitely there can be issue with painful sexual intercourse. Some people, when they are breastfeeding, because estrogen level is also low, they can also have pain when they are having sex. And in some people, it's because of some drugs that they are taking. For example, drugs we call as antihistamine, like our piriton, loratadine. Time you take them too much, the person can start experiencing painful sexual intercourse. Some birth control pills, e.g. OCP, can cause painful sexual intercourse. Some drugs that they use for people that are depressed, they can cause that as well. And apart from that, we can have infections, things like urinary tract infection. That means when that area that controls how we urinate, if that we have infection that in those areas, we can have painful sexual intercourse. That is why some painful sexual intercourse, especially deep one, can really be deep-seated, and somebody can be feeling it on the bladder even minutes after they've even finished having sex. So it can occur because of that. Then we have what we call eczema. It's a skin disease. It's not people used to call this thing that Yoruba call ifo. Some people call that eczema. That's not actually eczema. The name of that is pityriasis vesicular. Eczema is a skin disease. Some people can have it in the vagina, and it can cause painful sexual intercourse. The people that use all these different things, people use different things to clean their vagina because they want it to smell good. Those things too can cause some burning, can cause some ulcer, which can also result into painful sexual intercourse. And some people that have had some surgeries before, like Episode told me, maybe when they want to give birth, the opening is small, they just cut a little bit. That can cause also painful sexual intercourse. There may be some surgeries that people have done, pelvic surgery, that genital area surgery can also cause painful sexual intercourse. And you see, in some people, it can be just some belt defect, like something we call imperforate hymen. Ideally, you can check my other videos I've tried to explain the female genital part. Ideally, there's something we call vaginal orifice. That's the place where our menstruation come out from. That's the place that the penis will pass through when we are having sex. That place is normally covered by a skin that we call hymen. And there will be a hole that is just left for the menstruation to come out, for also penis to go in and things like that. But when people start having sex, some of these things can be removed, all of them or some of them. But in some people, the hole is not there at all, so they might need surgery, something to just do to help them to create the hole. For that kind of people, they can have superficial painful sexual intercourse, because by the time penis want to pass through the hymen, it can really be very painful. So for people like that, they can have that. Or so people that have something called vaginogenesis, maybe the vagina is not well developed, and like that, those kind of people too can have what we call painful sexual intercourse. And also the deep painful sexual intercourse that we're talking about too, somebody with what we call endometriosis. Endometriosis is when the lining of the uterus, that tissue, when you find it somewhere else in the body apart from the uterus, that too can make people have painful sexual intercourse. Some fibroids can cause painful sexual intercourse. And something we call pelvic inflammatory disease, PID. And you see, that one is mostly caused by sexually transmitted infections. It's a complication of sexually transmitted infections. When sexually transmitted infections, when they are not treated or they are poorly treated. And you know, the problem with sexually transmitted infections is that most people are asymptomatic. They don't even know. But that infection can go up and go to all the pelvic area, make the place to be diseased, make the place to be fibrous, like the place will be matted together. So they can have pelvic inflammatory disease. And when people have the pelvic inflammatory disease, PID, they can have pain when they are having sex. So we have so many factors that can actually cause painful sexual intercourse, and there are things that can be treated actually. So if you have, they just come to the hospital, because a lot of times in this part of the world, people don't like talking about things that have to do with sex. But don't suffer in silence. Come to the hospital, and if you have any questions, you can contact me on my Gmail, Dr. Tinoade, talking about sexually transmitted infection 023@gmail.com. I will take that again, Dr. Tinoade, talking about sexually transmitted infections 0323@gmail.com. Till another time, bye.